Hey guys, welcome back. I'm Corey. I'm here with Jennifer
Hey guys.
for Dr. Marketing Tips. And today we're starting Module 2 of our 9-part marketing course. So, over the last 3 weeks, we've talked a lot about inbound and outbound marketing and hopefully given you some things to think about when putting together your next marketing plan. So, this week, we move into a new area of your marketing plan altogether. We're going to be discussing all kinds of things having to do with achieving and maintaining patient satisfaction. So, this is actually going to be a 2-part discussion. We're going to cover half this week and half on the next week webinar. We're going to go into detail about everything from the staff's role in overall patient satisfaction to patient surveys and even dealing with negative feedback.
Now, we know that we're throwing you a lot of information, and that's why we've actually broken this medical marketing course into 9 separate segments. Hopefully, each week you'll give some thought to what you've learned and even found ways to apply your new education to your role back at the office.
And because we're assuming that you might have some questions or want to discuss some of the material, we're going to invite you, if you haven't already been there, to post your questions in the Dr. Marketing Tips community forum, where we will actually go in and answer them, and you can also interact with some of your peers as well. The online forum is a great place for you to meet some of the other folks who are going to be in the same boat as you. That's, the boat where you're wearing too many hats and you're trying to market your medical practice and do about 1,000 other things. You'll be able to share some of the best practices and get some good advice that may translate to helping you do your job just a little bit better.
All right, so let's get started. So today is all about the patient and achieving patient satisfaction. A couple of things that we've got to consider before we get too far into today's presentation. First, let's talk about this. What happens at the appointment is only about 25% of the interaction. You know what I'm talking about here. It's not just when the patient shows up the day of for their appointment. They have called in and requested an appointment. Maybe they've gone on your website and that was their first interaction with you, is requesting an appointment online. Or maybe it was when they called your appointment line or your scheduler and they were put on hold for a couple of minutes. And then they come into the office to be greeted at the front desk. Then they sit in the waiting room for, let's say, 10 minutes. Then they get ushered into the back and they go into a patient room. They wait another 10 minutes. Then the physician shows up and then the physician's in there, let's say 7 minutes. Then they might get a chance to talk to a PA and then somebody escorts them out and they fill out some exit paperwork. So what happens actually at the appointment is only a small segment to achieving your overall patient satisfaction. And then we've talked about this a little bit before, but this is a year that patients are definitely in the driver's seat.
Yeah, we mentioned that in the last course and a couple of times before that as well, with patients having the ability to go on to different rating sites and actually make or break your reputation just by leaving a couple of posts on some prominent rating sites. It can really change the entire perception of your practice.
And then another thing to consider is the ethical conundrum for providers just in general. There are actually quite a few examples out there where docs, especially in the hospital setting, are so focused on patient satisfaction scores, most likely because it's tied to their salaries or to reimbursements for the hospital in general. So they're so focused on these patient satisfaction scores that they're prescribing unnecessarily simply to make the patient happy. And I was actually listening to a discussion last week where a dad brought his son um, in to see his pediatrician for a cold, and the pediatrician didn't want to prescribe an antibiotic because he knew that it was just a virus and it needed to work its way through the system. But dad was getting an earful from mom back home saying, make sure that you pick up an antibiotic, and was rather upset that the doc didn't prescribe it. And the conundrum for the doctor is that he knows that it doesn't make sense to prescribe the antibiotic for a common cold, but in the face of a potential negative patient experience, what's he supposed to do? So these are all things to consider as we're discussing patient satisfaction in general, moving forward for medical practices. So how important is patient satisfaction? Well, your patient's overall satisfaction and your scores is literally the difference in your bottom line. And this is the case many times in reimbursements that are being offered these days for Medicare And it's literally the difference in referrals that you may or may not get. Your overall patient satisfaction when somebody walks out of your office is the difference between, hey, Corey, this is my dermatologist. I think you should go see her. She was great. She caught this, she caught this melanoma on my nose, versus someone going to Facebook and saying negative things about you, and it takes months before you even find out that they're talking about you. And patient satisfaction, it's the difference in building long-standing relationships with other docs or getting the one and done kind of referral. So we talked about it last week in our discussion on outbound marketing and building a referral system with other providers. But the fact is, you've got to provide great customer service, not just to the patient that walks off the street, but to the physician who has, to the patient that is a patient of a physician who referred to you. If you're not giving good quality service to them, and remember that appointment's only about 25% of the entire equation, but if those patients aren't walking out of your practice happy and kind of giving feedback to their referring physician, chances are you're going to get the one and done referral. So let's talk about what's ahead. Today we're going to talk about the role of staff as it relates to overall patient satisfaction. We're going to talk about patient satisfaction scores and what they mean. We're going to talk about patient surveys. We're going to talk about dealing with negative reviews, because they do happen for all of us. And we're going to talk about encouraging positive feedback that'll help us overall in achieving and retaining patient satisfaction.
All right, so first up, let's talk about the role of staff in patient satisfaction. Now, I believe this is actually one of the most important things because, when you think about it, if you go into, let's go back to what we used a few weeks ago into a restaurant. If you walk into a restaurant and, the hostess is frowning or you don't get greeted right away, or actually, I just had this experience earlier today. I walked into a Starbucks and I stood at the counter for, it felt like an eternity, but really it was probably about 30 seconds or so before someone actually came up. They said hi, and then they went to go and deal with a vendor in the back before taking my order. And so obviously I had a negative experience there, and that's all on the staff. And the same thing can be said in your office. So your staff gives the first impression, so you have to make sure that it is a good one. You want smiling staff. You don't want to be able to. You don't want your patients to be able to hear the gossip that's going on in the back.
I think there's something to be said. Starbucks used to do this. Chick-fil-A is very good at it. My mother actually owns a restaurant, and they make it a priority. But there's something to be said about that first impression when somebody walks in the door, and having a certain time frame before you look up, smile, and greet the patient. Especially if you have an opportunity to know your patients by name. This won't work for the larger practices, but for the smaller ones, you might actually have that type of relationship. And so, maybe the rule is, within 15 seconds of that door opening, you're going to say, hey, how are you? Can we help you? Come right over here, or have a seat and we'll get to you in a minute. But that first impression makes all the difference in the world.
All right, so building off of how the importance of staff, let's talk a little bit about patient flow. So in a typical office, patient will come in, they'll visit the front desk person, and then they're told to either fill out some paperwork or go sit down and wait, and somebody will call their name. So at that point, they sit down for about 20 minutes or so. Someone comes through a door, says their name, they follow them. There's an interaction there. Then they might go sit in the exam room for another, hopefully, let's say 5 or so minutes. Then a different person might come in, and there's another opportunity for interaction there. Most likely that's a nurse. And then they wait again, and then the physician comes in. So there's your next interaction. And then after that, the same nurse might come back, or it might be somebody else, and there's another opportunity for interaction there. And then on the way to checkout, well, they're seeing somebody else there too. So that there's a lot of different touch points while they're in the office, and it's important to make sure that you do everything within your power to make sure each one of those is a positive experience. All right, and the last thing that we're going to talk about on this slide is how small adjustments can make big differences. Now, that's something as simple as just having coffee out. We work with a practice that actually serves Starbucks, and patients absolutely love it. And it's something small that they can do to really kind of go that extra mile. It can be anything from making sure that there's fresh magazines out, or that that the TV's not blaring or on MTV when you are dealing with an older population, just things like that. So one of the best things that I suggest, and I think that you can do, is think about the last time that you actually went into your lobby area and just sat there for 5 minutes. Go ahead and try that, during one of the busy times of the day, and just take a look around, see what marketing materials are out, and see how the staff is interacting with patients and what the patients are doing and what they're looking at, what they're not looking at, and just kind of the overall vibe in the room. So, what is your policy for interacting with patients when they arrive for their appointment? We touched on this just a few minutes ago, and that really means once they come in, what do you have anything in place with what they should be doing, what your staff should be doing, and where they should go, and kind of map out that before the patients even get there?
One thing that you can consider when we're talking about, your policy when people are walking in the door for the first time is just take a look around your office or think about what that first impression is when people walk into the office. Office designs have actually changed over the years to help improve patient satisfaction. So give some thought to how your office is actually set up, and then what is it that you could maybe put into place. Maybe it's not, knocking down a wall. Or something drastic like that. But maybe there's some basic things that you can do to help make that first impression the best that it can be. Do you have a partition that divides the room? As in, do your patients walk up to a little window like they're ordering something? Typically the girl behind the desk is looking down, and the patient walks up to the girl behind the desk, and it might take a minute, and then she looks up and says, you need to sign in, and the patient is forced to sign in almost like they're cattle being moved through the system. But newer offices rarely have this type of setup. In fact, the partition is gone, and now it's almost like being at a coffee shop or in a nice hotel. So, what is that first impression, not just from your staff standpoint, but from your office standpoint in your waiting room? How is it that you're greeting people, and do you have a plan in place?
Yeah, I was in an office the other week, and they actually still had one of those little bells that you would ring right there, and I just wanted to take that and throw it away. I mean, if the person behind the desk, if they're not paying attention to the point, or they're not there, and you have to ring a bell, you're really kind of doing something wrong there, and you're doing your patients a disservice. So another touch point that you have with your patients is obviously before the appointment to call for that confirmation, or whether you have a text message set up or what have you. But there's an opportunity before the patient actually gets to your office to interact with them and make sure that it starts off on the right foot and it is a positive experience. And then also after the appointment, are you doing anything to follow up? Or is there a survey or a phone call just to make sure the patient's okay? Little things like that. Again, they can make a huge difference, especially in the eyes of a potential patient and potential referring physicians. All right, so a few key things to remember when it comes to the role of staff is communication. Now, that's communication between you and your staff, and then it's a trickle down effect. So, you also want to make sure that communication is okay and going well with the physicians, as well as making sure that your staff is communicating with your patients properly.
It's all about managing expectations. I think we would all agree that, sometimes if we have to wait to get to an appointment, maybe our hairstylist is running late, not in Corey's case because he really doesn't have a lot of hair, or maybe you're getting we don't love it when the cable company gives you a 2-hour window, but if they call you and say, hey, we're running an hour late, a lot of times you can deal with it. What Corey is saying is absolutely correct. You can be delayed, you can be behind schedule, you can even make people sit unexpectedly and throw off their day, but you can't do it unless you're communicating with them on a minute by minute or every 10 minutes, letting them know exactly what they can expect. It really is all about managing expectations, because when people feel as if they're part of something, which is actually the next point here, if they feel engaged, then chances are they're going to give you a positive review, because they're going to feel like they're part of your practice, and it was okay the doctor was running late, because you know what, Jane, the desk girl, kept me current on everything that was going on, so I knew why it was I was sitting there waiting.
And lastly, the ability to diffuse situations. So, again, this is another preemptive approach that you can take where it's best to have some policies and procedures in place when you believe that something negative may happen. It happens to all of us. So, the best thing to do is actually have a plan in place and be prepared when something happens. So, if there's an angry patient in the office, then, how is that handled? How do you treat them? How do you talk to them? Where do you talk to them? And who gets involved in that conversation? Things like that. It really does make it makes a world of difference to take 10 minutes or so and come up with that plan. And we touched on this a little bit earlier, how staff can make or break the overall patient satisfaction experience. And, a smile goes a really long way. And so does the small things that you can do in the office to keep the patient engaged. That can be anything from offering them Wi-Fi to, having a television on or the magazines like we mentioned. And those things really, really, really will create such a better atmosphere for the patient. It's interesting when we go to offices. Sometimes we'll see that there's no TV, there's no music, there's no magazines out. Maybe there's some rack cards or something like that. But I mean, I don't know about you, but as a patient, I don't want to sit there and read 12 doctor bios.
There's nothing worse than when you're sitting in a patient waiting room or a lobby and the magazines that they've got out there are 2, 3 years old and all the good coupons are ripped out of them, or people have drawn all over the people's faces. So keeping things current really does go a long way.
So one of the things that we found that works really well is having the staff encourage those positive reviews. If you have a patient that just is absolutely in love with you, and you know that, and that can be anyone, whoever sees that, if it's a nurse, if it's the checkout person, whoever, they can actually create a card or send a link, or there's a multitude of things that they can do to direct those patients to leave a positive review on specific sites, whether that's a physician review site specifically or something like Yelp or Google. But following up with them and making sure that the experience was okay and saying, oh, hey, here's this link. Would you mind leaving us a review about your experience? And things like that can really help your online reputation management. And they can also have a benefit to your SEO.
So let's talk about patient satisfaction scores. So this is a message from Press Ganey CEO Patrick Ryan back in January of 2003. He's been in the healthcare industry for years. And basically he says when it comes to patient satisfaction scores, you just need to suck it up. He says, nobody wants to be evaluated. It's a tough thing to see a bad score. But when I meet with physician groups, I tell them the train has left the station. Measurement is going to occur. And I think we all understand this, especially when it comes to HCAP and CCAP scores. The government's measuring overall patient satisfaction across the country, and you need to be measuring overall patient satisfaction in your individual practice so that we are all delivering the absolute best patient experience possible.
All right, on this next slide, this is actually from PubMed.gov. This is from a survey of about 500 urologists. And essentially, what it says is that we advise physicians and patients to be aware that most urologists are rated on at least one physician review website. And you guys are too, even if you're not a urologist. And most of these ratings are favorable, but the composite scores are based on a very small number of reviews, and that can raise issue. So the thing to remember there is that although you can be rated, one 5-star review, you could have that 5-star rating from a composite standpoint. But if you get a 1-star review, well, all of a sudden that's shot. So the good news there is that it only takes a small handful of reviews to really raise your score. And on the other hand, it could just be 2 negative reviews that could be detrimental to your practice.
So let's talk about the methods for measurement. First, we've got the consumer assessment of healthcare providers and systems, commonly referred to as CAPS or CCAPS. And then the next one we'll be talking about is online physician rating sites. This is actually what we were talking about, where your patient's actually in the driver's seat. These are the types of measurement tools that put your patient in the driver's seat in a very visible way. And the third type of measurement that we're going to be discussing today is social media as an outlet to vent or on occasion as an outlet to offer some praise. So let's start with CAHPS, Consumer Assessment of Healthcare Providers and Systems. That's what it actually stands for. And CAHPS is a series of patient surveys rating healthcare experiences across the United States. The surveys, conducted annually since 1995, are available in the public domain and focus on healthcare quality aspects that patients find important and are well equipped to assess. Results are used by Medicare in determining diagnostic-related group payment per hospital. CAHPS surveys are funded and overseen by the Agency for Healthcare Research and Quality. It's a government organization, often known as AHRQ. And the ARC does not administer the surveys. In fact, the surveys have to be administered by a qualified vendor. And essentially what this is your CAHPS surveys, or the HCAHPS surveys as they're known for the hospitals, are a series of quality assessments that get sent out to the patients. And then your office is judged based on how it ranks compared to other practices. CAHPS are actually the surveys will to help you compare clinician and group survey data, your data compared to the rest of the sample data from across the United States. And the survey questions themselves, there's all kinds of surveys that are available to you actually for free. You can go and use them as a sample. And we'll talk about it a little bit more when we talk about patient satisfaction surveys. But if you take the feedback that you get from your patients seriously, they give you a real opportunity for improving overall patient care and patient experience within your office. Meaning, if you take seriously what people are saying, you take that feedback to heart, you can really improve the level of patient satisfaction in your office based on the CAHPS. And they also report clinician and group survey scores to consumers. So we've seen offices where they get really good scores and then turn around and use it in their marketing materials. 97% of our patients were highly satisfied with Dr. Jones.
All right. And the next method of measurement is online and local review sites. So these allow for anyone to review your physician or the experience at your practice. Okay. And so the issue here is that there's no barriers to entry, and there's really there's few defenses against those who would use this medium to attack and to really kind of sabotage and put you down. So some of these examples include healthgrades.com, ratemds.com, vitals.com, Google, Yelp. There's literally hundreds of them. It seems like a new one pops up every single day. We advise that you only concern yourself with the ones that are going to show up on the first page or two of Google, because if you're like 97% or so of the people in the world, you really don't go past the second page of Google. All right. So in addition to these rating review websites, patient reviews happen on social media too. They can happen anywhere. So, and the thing about the social media reviews is that they are instant. They have typically a very large reach because whoever leaves that review, it will show up for their friends and followers of their followers, and there's immediate feedback too, and that's both good and bad. And this feedback, it's often rated very highly by the patients and their followers because it's from trusted friends. So here's an example of a negative review. And luckily, what the practice did was smart. They didn't waste a lot of time. They actually hopped on there and they responded right away. And they actually had this review response. It was canned and it was just customized slightly in response to this particular reviewer. Now, this is one of the unfortunate things about social media. And luckily,
I'll jump in real quick too. One thing, if you look at the canned review, that you might notice is that the practice provided a phone number. We've worked with this practice and we know very well that this is not their main appointment line, but this is a direct line to an individual that has been designated within the practice to deal with negative complaints. And sometimes just saying, "Hey, give Lisa a call at this number," diffuses the situation. So I would put that in your toolbox as a tool that you can use, is just having a point of contact that you can direct people to immediately if they have an issue. You'll see that no information was given up about this appointment or the practice, and really no blame was accepted, nothing like that. But we gave them a solution. If they really wanted to make a formal complaint and not just air their dirty laundry on Facebook, we gave them a way that they could do that.
Yeah, that's a great point. And the thing is too that the odds of this patient actually calling that number are very slim. But what it does is, for everyone else that sees this, they see that the practice responded quickly and they gave them a dedicated line and someone that's going to be there on the other end to answer. And so the point I was about to make is, this is one negative review, sure. So how do you combat that? Well, your job is to go ahead and solicit these positive reviews. And overall, what that does is, it's really, one, it pushes the negative review far down the list where hopefully no one will ever see it. And it also raises your overall average. So when people, let's say this is from Facebook, obviously. So when people visit your Facebook page, they'll see that it's 4.5 stars out of 5, and hey, that's not too bad. So as far as social media sites are concerned, there are what would you call it? A gaggle of them. I mean, there's
Plethora, a
plethora.
gaggle.
There,
Too many.
yes, I think too many is probably the right answer. So the list here is just a few of the ones that are heavily populated and heavily used by users. And on pretty much each of these sites, they all have the ability to comment. They all have a voice, and they're all going to use it.
All right, so let's talk about patient satisfaction surveys. And to me, the most important thing that you need to do when your administrator comes to you and says, hey, I want to measure patient satisfaction in the office, is to ask them why. What is it that you're planning to do with these surveys when you get responses? Because I think that'll help you, one, save a lot of time. Two, it'll help you save a lot of money. And three, it'll help you save a lot of headache. When you're determining if you're going to do a patient satisfaction survey, and once you've figured out why you're planning to do it, there's a couple things that you need to consider. What type of survey do you want, paper versus online? And like I said, what do you want to do with the results? Because it's not always rosy what you might hear. So if you hear negative feedback, do you have a plan in place to address it? A lot of times we hear that the doctor was running late and there's not much that we can do, unforeseen circumstances. So it's just expect to see some of the negative stuff coming through, and you may not have a plan or be able to address it.
Actually, yesterday I was sitting in a meeting at a doctor's office, and we were discussing a negative review. And the review basically said that the doctor came in, he spent about 10 seconds with me. He never looked up from his tablet, never made eye contact, and then he walked out of the room. So, kind of piggybacking on Jen's point here, when that happens, you receive negative feedback about a doctor. One, do you tell him? Is he going to take it well? And what do you do with that? Do you approach him and just kind of generally say, hey, we've been hearing some complaints and this is how we're going to fix it? Or do you just kind of let it go by the wayside?
Because the first thing the doctor is going to say is, who said that? And then if you don't have a sample of a handful of similar feedback, then they're not necessarily going to believe that they've got some sort of trend or something that they need to address. They're going to say, oh, that was just kind of a one-time thing, and I don't think it was that bad. And we say that because we've all worked with physicians and we work with them on a daily basis, and they're very intelligent and they work hard, and they didn't get to where they are by not giving good bedside manner. So sometimes it's all a matter of interpretation.
You forgot to say hard-headed sometimes too.
Yes, very hard-headed on occasion, but we do love them. So if you receive negative feedback about your staff, this is another one, because remember, the time that they spend with the doctor in your office is really only about 25% of their interaction at your office. So if you receive negative feedback about your staff, are you willing to make adjustments? And are you willing to possibly order some customer service training? Because sometimes we all know what it is to give good good customer service. We know that you should greet people with a smile. We know that it's polite to say hello and to say goodbye, and that you should address people by their name and look them in the eye and show empathy when you need to show empathy, and be encouraging when you need to be encouraging. We all know this. This is, typical human traits and things that our mothers taught us. But the fact is, sometimes we just need a little reminder, and sometimes actually some structured customer service training can go a very long way. Here's another thing with your patient satisfaction surveys, and this all goes back to the why. If you're going to get these things, and so you have to know, is this stuff you want to hear? And if you hear it, you have a plan in place. So are you ready to see it in writing that your doc runs behind schedule? He doesn't spend enough time with patients, or she takes it takes a week to get on her schedule. These are things that you'll probably hear, and you want to be ready and have a plan in place on how you can respond to this. And are you okay? This happens if you get negative feedback from a patient, knowing there isn't much that you can do about it. Corey and I deal with a lot of online reputation management for our clients specifically. And there's one website out there in particular with a couple of clients of ours where they're constantly getting negative reviews. And those negative reviews are typically related to work comp. And it's 9 times out of 10 a patient that didn't want to be returned to work in an expeditious manner, and felt like the doctor should have signed off on them being out of work a little bit longer. And so we spent a lot of times arguing with this particular website, trying to get reviews taken down, specifically because they are just a disgruntled patient that doesn't really have an argument or a dog in the fight on this one, and it negatively affects the doctor's reviews. So you just have to be prepared. There may be times where there's nothing that you can do about it. You may be times where your doctor runs late because he does emergency room duty right before, and he's busy saving somebody's life, and that's why he's running a little bit late for his rounds. Another thing that you can consider if you're going to pay attention to patient satisfaction surveys, especially the online ones, for the reputation management that we've talked about, they tell you what questions are on the test. They especially health grades, it's pretty simple. They want to talk about ease of scheduling, urgent appointments. How was the office? Was it clean? Was it comfortable? Was the staff, courteous and friendly? So these are things that if you ever do that customer service training by a professional, or if you have somebody in-house talk about it with your staff, you can teach for the test actually. And really a good way to inflate your overall patient satisfaction surveys just by letting your staff know what people are going to be looking for, just to remind them that they're being judged on everything they do. So remember how we talked about CCAPS, the Consumer Assessment of Healthcare Providers and Systems? I mentioned before that they literally give you the answers, or give you the questions to the surveys. And we'll have them in the show notes. There are several websites out there on the ARC group, that's the acronym, that actually provide you all of the surveys and all of the questions, whether it's an adult patient, a child with the adult caregiver filling out the survey, whether they even go down to certain types of practices. These are surveys that have been put together by professionals, survey folks. These are questions that have been tried and true since 1995 when they instituted CAPS, and they're free and they're available to you. So whether you are judged, whether you offer Medicare, and whether you are judged on the CAP surveys or the HCAP surveys, regardless, if you're going to consider putting together a survey for your office and you need to come up with a handful of questions, this is a good place to go. So let's talk about the types of surveys. There's really 2 types of surveys. You've got either a paper survey or you have an electronic survey. So let's talk about the paper surveys first. Well, the pros are they're inexpensive. You come up with a couple questions and you print them off, and they're easy to implement. Everybody understands. You hand them a survey and they fill it out. And patients and staff are very comfortable with using paper surveys because we're all used to them. So the cons are there's lots of extra paper that you have to now keep track of. It lengthens the process for the patient. When are you going to offer them the survey from a patient flow standpoint? At the beginning of their visit, while they're sitting in the waiting room and waiting for the doctor, whether in the patient room waiting for the doctor, or are you going to do it after they have waited for the doctor and then the doctor spent 10 minutes with them and ask them how they're doing at that point. So it does lengthen the process, and it's kind of tricky when you're going to do it. And then another con is somebody has to manage all that data so that it can be reviewed. And we don't mean, I don't mean they have to manage the data in that they got to look at it, but actually somebody has to take those paper survey questions and input them into some mechanism so you can see what kind of response that you're getting across the board is. And every year we have a client that every year we compile all of their paper data and we put it into spreadsheets, and then we chart out kind of what the general responses are. And we're talking hundreds and hundreds and hundreds of surveys that then have to have their data input into some sort of electronic format so that you can then present it to the physician so that you can make adjustments. And because they are paper surveys and there's a lot of handwriting, there's a lot more room for error because sometimes it's just hard to read what people are writing. So let's talk about online surveys. The pros are, and there's pros and cons to both, so it just depends what works for your practice. The pros are that an online survey is very inexpensive, and in some cases it can be free. They are relatively easy to implement. I like that you can do an online survey and you can ask a series of questions one day, and you can on the fly change to a different series of questions if you're trying to measure something different tomorrow. Data is input directly by the patient, which means a lot less room for error. And how I kind of told you about, the client of ours that every year we have to input hundreds of these patient surveys into electronic form. The patient's actually doing it for you, which just saves you a ton of time. And then you can add kind of optional things on your surveys. And one thing that Corey and I have done pretty successfully in the past is added an optional comment box for testimonials of the practice and of the experience. So when somebody's having a good experience, you give them a chance right then to write a testimonial or to reveal their name or something like that. You can keep surveys online anonymous. It's much better from a HIPAA standpoint. You don't want to know who the patient is. You just want to know overall if they are accepting of their experience at your practice. But online surveys have some cons too. Patients are more likely not to provide feedback once they leave your office. And we tell you this because chances are with an online survey, you're going to email them an anonymous link, or you're going to put it out there on your website. So once they've left the office, they've probably stopped thinking about their appointment and they've started thinking about something different. And somebody in your office still has to do some work. Maybe they don't have to input everything into a database, but somebody has to be responsible for sending out a link to the survey to make that step from the office to actually getting somebody to fill it out.
And one of the things that you have to remember with online surveys as well, we've actually we get asked this question a lot. People ask, should I have a tablet or a little computer station or something like that where they can actually fill it out while they're in the office? So that actually presents a couple of pros and cons in itself right there. In fact, Google actually discourages having a review kiosk at your location. And if they find out that you do have one, they'll actually remove the reviews from there. So if you worked really hard to get all these reviews and then they find out that you're soliciting them in the office, they can actually get taken down before you know it. So as with anything, there's a couple of pros and cons there. The pro is that people will fill it out right there, and you get the results, and you know that they did it. But they could also be worried that someone's looking over their shoulder or recording the results, so you don't really know if they're very valid. So just a couple other things to consider there.
Good points, Corey. So, and then kind of your third option when it comes to surveys is you can hire a third party like a Press Ganey. They're very good at what they do. They're an industry leader. They actually do it all for you, and it's very scientific, and you'll get some nicely formatted data. And if you're under the requirements for HCAP or CCAPs or CAP surveys, as we talked about before, the ARC doesn't actually, ARC being Agency for Healthcare Research and Quality, the ARC doesn't actually administer the surveys. They require that a qualified vendor administer the surveys. So there's pros and cons to hiring somebody, and it all kind of depends on when I first brought this question is, the first thing you have to ask yourself is, why do you want to do the survey in the first place? Is this internal, or is there something external driving it? and are you willing to do something about the scores? Um, Kind of a con to hiring a third party provider is that it can be very expensive. So again, you just have to go back to the question is, why do you want to measure patient satisfaction, and what are you going to do when you do find out what your patients are thinking about your practice? So a couple of options for the surveys themselves. One is, let's say you want to do an online survey and you want something that's absolutely free. We can go into Google through your Google account, and you can use Google Drive to set up an online anonymous online survey. Very simple to set up, and Corey actually has a webinar that he has done showing you how to set up a Google Drive survey. Simple, inexpensive, as in free. Quick. You can have it up within a matter of maybe, what do you think, Corey? 20 minutes if you wanted to, about 20 minutes, and you could be rocking and rolling by the end of the day. Another option for your patient satisfaction survey would be a service like SurveyMonkey. SurveyMonkey is very easy to use. And again, Corey has a separate webinar just on setting up your SurveyMonkey account and your first survey that you would send out. SurveyMonkey has a free option. They have a paid option. They have options that are HIPAA compliant. They have packages that, and maybe you didn't want us to do an anonymous survey, but they have an entire kind of package deal that you pay for that is HIPAA compliant, but the same thing gets across. You can have quality surveys, relatively inexpensive, as in very inexpensive, something that a one doctor office could easily afford, and you could get a quality survey. And for the most part, SurveyMonkey is one of the leaders, or if not the leader, in getting surveys. So people are used to them, and most of us at this point have probably taken a survey online, and it was probably administered by SurveyMonkey. And then the final option is, as we discussed, is hiring a third party just to do it for you. Probably for a larger practice, hospital groups. Every hospital group I've ever worked with uses Press Ganey. They are definite leaders in the industry, and they really do provide a quality product and a huge amount of data points when you get the surveys back. But they are expensive, at least in relation to what I'm used to seeing physician offices pay. So chances are, if you are going to use a third party provider, you're a much larger practice.
All right, changing gears a little bit, let's talk about what to do when you do get a bad reviews. You can have all the surveys that you want, but if they're all coming back negative, then something needs to be addressed. So let's talk about bad reviews online. First off, they're going to happen. They happen to all of us, no matter what. You can't please everyone all the time, especially when you're dealing with work comp patients. It seems like they are some of the more vocal majority out there. So just be prepared that those things are going to happen. So instead, you should have a plan or a policy in place for responding and dealing with these reviews. So we touched on it earlier with the practice that had the negative review. They actually had that canned response kind of written. They already know who the person in the office is that's going to go ahead and answer that phone, um, and they just kind of tweak it when they see the bad review. So that way they can respond quickly, and they have a brand message, and it really works out well for them. So some of the sites, they'll allow you to dispute the reviews if you can prove that they are untrue. And unfortunately, each one of those sites, they don't actually allow you to do the same thing. So it's kind of on a site by site basis. But a lot of them will allow you to either dispute, respond, or delete the review, depending on where you are and what kind of evidence that you have. And no matter what, you have to respond to the reviews and attempt to make the situation better. And the sooner that you do that, the better it is, not only for the disgruntled patient, but as I mentioned earlier, for any other patient that that might be out there and come across that review. So it's okay to take the blame here. You can say that you apologize, and you can say that you're sorry. You don't be afraid to say that you were in the wrong here, because what you have to do is diffuse the situation. And if it's possible, assure the patient that it won't happen again. And really what you're doing there is assuring other patients that happen to come across that review that you have taken steps to make it better.
As Corey was saying before, back to the idea that, sometimes there are negative reviews and there's nothing that you can do about them. But there's other times there's negative reviews, especially on the online reputation sites, where there is something you can do about them. And as Corey said, you can reach out to them and you can ask them to take it down, especially if you have documentation. I'd say 7 out of 10 times the sites are responsive and they take it down. But one point that I want to get across is that this is not something that happens overnight. In fact, we've had it take months on occasion to get negative reviews. Even things that were blatant employees that were disgruntled that left the practice just talking smack about a physician and about anything and everything that they could air their dirty laundry under an anonymous posting or a fictitious name. It still takes months on occasion. So go back to, we got to manage expectations for the patients. We have to also manage expectations for the physician and for your administrative staff, that you may be on top of these online reviews, but it's a lengthy process to get things removed, which is why it's so critical to be paying attention to what your patients are saying when they are leaving the practice.
Yeah, and let me mention that going back to the fact that it took months to get some of those reviews off, that wasn't from a lack of trying either. That was from being persistent and just bugging the site really as much as we could. So that's something to think about too. This is kind of what we do on a day-to-day basis. So we had the time and resources to do that, and it still took months. So you got to consider that with your plan as well. So when you're responding to these reviews, you want to make sure that you show that you care and you're going to do everything within your power to rectify the problem. Now, obviously, in some situations, you can't actually fix the problem, but in a lot of them, you can. So it's just a matter of having that plan in place. And then what we talked about earlier on one of the other slides is once you get that information, what do you do with it to make the practice better? And by dealing with these negative reviews and promoting the positive ones, you're actually going to help your online reputation. You're going to show up higher in search results, and you'll wind up with more patients because of it. So, one of the things to remember is that sometimes people are just out to get you. It happens. Like I said, a lot of the work comp patients are very disgruntled. And we've also dealt with angry former employees that wanted to, as Jen mentioned, air the dirty laundry. And there was a lot of dirty laundry to air. So,
Especially there's so much dirty laundry, especially when people think that they're anonymous. So sometimes negative things happen. People sometimes, like Corey said, sometimes they're just out to get you, and as long as you have a plan in place, you can deal with it.
So, what do you do when you do have a patient that's out to get you? And there is someone out there and they're spreading untrue things about your practice. Well, one of the things you can do is you can hire an attorney because it is slander. You can also reach out to the website and make a case for having the review removed, especially if you have evidence to the contrary. Once you have that, you pretty much have an ironclad case that it's not true and it needs to be taken down. You can also be proactive in your content development, and that means essentially you're putting out positive written articles or blogs and things like that to push these reviews down and out of the way, where they're just essentially as hard to find as possible. So the more testimonials and the more custom content that you have, that's going to benefit you in the end. And these testimonials can come from written testimonials. They can be pulled off of those online and paper surveys. They can come from video testimonials. One of the things that we do is we'll actually approach patients. We will film a video testimonial. We'll turn it into a written testimonial, so we get the SEO benefits from that, and it all comes together in a nice, pretty package to make the practice look as good as possible.
So just a quick review. As Corey said, online review sites, they force accountability. And there's nothing more important than just being on top of what other people are saying about you. The patient has more power than ever. We talked about it at the very beginning today, that the patient is in the driver's seat. This is true in healthcare. This is true probably in every industry out there. The internet has made everybody an expert. The internet has made everybody an instant reviewer. And when something goes bad, the internet is fantastic at helping disseminate information. So patient service is key. The ways of customer service of the past are much different than the ways of customer service of today. And delivering a positive patient experience takes everybody from the person picking up the telephone to the person scheduling the appointment to the way that your website is designed, whether you give them an opportunity to schedule an appointment, to the moment somebody walks into your office. Maybe it's the way that your office is designed for patient flow, to the way that the physician delivers care, even to the follow-up. Patient service is key, and it takes everybody in order to deliver something successful. So, investing in your employees and in your patients will pay off in the long run. We mentioned it before, maybe it's time to hire somebody to do some professional customer service. Maybe when your marketing department, or that, we know it's a one person marketing department in most cases, but maybe the person that is doing the marketing for the practice and managing the social media and managing the online reputation management, probably wearing your human resources hat or something like that. But investing in your employees and explaining kind of how social media works across the board to other employees so that they can understand how their actions might be causing reactions elsewhere. Good customer care, as I mentioned before, starts with the very first interaction, and making an investment in your people will pay off dividends in the long run.
All right, next up, part deux, as Jen likes to say, is the best patients are the ones you already have. So, with that, we want to say thanks again for hanging out with us, and hopefully, you're able to breathe a little bit easier now. And as always, check back to drmarketingtips.com for the latest news and tips. And hopefully, we will see you next week. Thanks, guys. Appreciate it.
Have a good one. We'll see you next week.